Hello everyone, welcome back to Learn with Med Nuggets. In this video, we are going to talk about Down syndrome. Down syndrome is the most common chromosomal abnormality seen in children. Down syndrome patients have 3 copies of chromosome 21, so it is also called trisomy 21. Tri means 3 and somy for chromosome. Trisomy 21 or Down syndrome is mostly caused by maternal non-disjunction. This is basically when the chromosomes are not split properly. So some cells will have an extra chromosome and other cells will lack chromosomes. And when the sperm fertilizes with the cell that has an extra chromosome, it will produce a zygote with 3 copies of chromosomes. Other than this, 3% of Down syndrome is due to translocation, and 1 to 2% of the cases are due to mosaicism. The most important risk factor for Down syndrome is maternal age. In mothers less than 20 years old, the risk of having a baby with Down syndrome is 1 in 1,500 births. Contrasts to when the mother is more than 45 years old, where the risk is 1 in 25 births. Having an extra copy of chromosome 21 can affect almost every organ. The most common heart disease seen in Down patients are endocardial cushion defects or atrioventricular septal defects. In the GI tract, it can cause intestinal obstruction, mostly due to duodenal atresia. Blood disorders include acute leukemias. It can also affect the brain, resulting in intellectual disability and Alzheimer's disease. Down syndrome is also a cause of sterility in males and congenital hypothyroidism. Other than these, there are several physical characteristics as well, such as an incurved little finger, also known as clinodactyly. Also protruding tongue, round face, flat occiput, open wide fontanelle, brush-filled spots on iris, a depressed nasal bridge, hypotonia, low-set ears, epicanthic folds, upward slanting palpebral fissures, single horizontal palmar crease, and a saddle gap, that is, a gap between the second and first toe, can be seen. Down syndrome can be diagnosed antenatally with ultrasonography and certain changes seen in biochemical markers. The features you see in an ultrasound are an increase in nuchal fold thickness, that is, more than 3 mm. This is the most sensitive sign that you can see in an ultrasound scan. Other features you may see are absent nasal bones, cardiac abnormalities, duodenal atresia, and a short femur. Changes in biochemical markers include a decrease in alpha-fetoprotein and unconjugated estradiol, and an increase in beta-HCG, pregnancy-associated plasma protein, and inhibin A. Changes in pregnancy-associated plasma protein and beta-HCG can be seen in the first trimester itself, and the changes of other markers can be observed in second trimester screening. Down syndrome can be confirmed prenatally with fetal karyotyping. It can be done by chorionic villus sampling done between 11 to 13 weeks, amniocentesis done between 14 to 16 weeks, or chordocentesis done between 17 to 20 weeks. However, all these 3 procedures carry a higher risk of abortion. There is no specific treatment for Down syndrome, but there are a range of therapies developed to improve their quality of life and help people with Down syndrome reach their full potential. With that, we come to the end of our video on Down syndrome. Hope you learned something, and if you did, please like, comment, and subscribe to our channel. Bye-bye.